Welcome to this podcast by CAFRE College Equine Team. I'm your host today, Ashley Robinson, and I'm joined with special guest Nikki Walsh. Hi, Nikki. Thanks for joining
Hi,
us.
how are you going?
Good, thank you. This podcast episode will be all things equine parasites, which, if you know me, you'll know that I'm very passionate about, and so is Nikki. So we'll try not to go into too many tangents. And it's an area of research that's kind of moving a lot, and there's a lot of research being done at the moment in it, so we've lots to talk about. Nikki is our special guest today and has an impressive background in research and publications and is currently in an associate professor position in University of Limerick. So, Nikki, tell us about your career and how, I suppose, you've been brought into the world of equine parasites.
Oh, for my sins, Ashley. I suppose I would have started off just what we would call a normal equine clinician, so headed off to Australia and New Zealand, all of those kind of things. But parasites really weren't at the forefront of disease in those areas, that's for sure. And then after about 4 years, I came home, started working close to home. I'm from Limerick, so started working in Limerick. And suddenly I was hit by the fact that multiple animals that I was facing were actually suffering from parasite disease. So I was like, okay. And, I should have really known from all of my beautiful parasitology education that I got previously, but I'd long since forgotten that. And it wasn't then until I moved into a clinical job in UCD where we worked with a lot of charitable organisations and maybe working with horses from probably poor socioeconomic backgrounds, etc., that we really saw parasite disease, like as in I would say 2 out of 3 horses that we were seeing were suffering from some element of
Wow.
parasite disease. And it was at that point that like I just had horses dying and I couldn't figure out why some were and some weren't, and I wasn't quite sure. There was a lot of, I suppose, gaps in the research around this.
Mm.
And I went to Grace Mulcahy and I was like, Grace, because she is, one of the top parasitologists in the country, if not Europe. And I was like, I don't know what's going on here. And she's like, neither do I. I think this is an area we need to investigate. And that's how I kind of fell literally into parasitology and a PhD, or the world of research. And thank God I did, because that's where I have remained. But yeah, and to be honest, in the 8 years that I was in UCD and now I'm in UL, I have now seen that parasitism, or the problems with parasites, move from what you would call your cobs or your little ponies that are picked up on the side of the road type thing, to starting to see so much more in what I would call mainstream equine, and even really, to be honest, really starting to come to fore in that high level thoroughbred industry, which is shocking them as much as us.
Yeah, because I suppose whenever you think about equine parasites, you sometimes automatically think about horses that aren't, you know, I suppose that have, maybe aren't in a great management situation, or maybe haven't had a
Exactly.
great, since foals. But as you said, like there's more and more coming up with our thoroughbreds and our performance animals, as well as our general leisure animals that are probably cared to the, wrapped in bubble wrap, and there's still issues.
Yeah, well, this is what we're starting to see actually. Like, as in, so I have some of the top studs in the country getting onto me with worries about certain horses not performing as well, losing weight, not looking as well coming into sales. But then I also, like, had international sport horse level farm getting contact with me recently because they had horses who were falling apart from
Mm.
parasitism, and probably due to overuse of wormers rather than anything else. And then as well, I suppose what we're seeing, like you were saying, is that like the everyday horse sometimes is presenting too. So we definitely have seen a different demographic coming to the fore. And it used to be that like if you had parasites, it was like a dirty farm, you know what I
Mm.
mean? A poorly kept farm. But now what we're seeing, because of the rise of resistance in our wormers and they're not working against our worms, that places that over relied on those and didn't, as you and me harp on about all the time, didn't really emphasize the other aspects around pasture management, etc., are the ones that are now starting to see problems because that over reliance isn't working.
Mm. Yeah. And do you think that there is more knowledge on and awareness of parasites? It's not just what the wormy looking animal in the yard. Do you think people are a wee bit more aware of it now?
Yeah, it's a really good question, isn't it? Like, do we see more of it because people know more about it, or do we see more of it because there's more there? And I think
Mm.
both are true. I do think even though some people are yet so surprised when it's parasites, especially because of there's a good few myths out there around parasitism.
Hmm.
So, for instance, at International Sport Horse Yard, they said to me, "Oh, it's definitely not parasites because the horses lost weight after we gave them wormers." Which, as you and I both know, is actually a really good indication that it
Hmm.
is parasites, right? So, I think again, it's that belief that once a wormer is given, the parasite side of things are sorted.
Hmm.
Um, but yeah, like I think there is more awareness, and I certainly think that people are seeking out help from the likes of yourself and myself a bit more because they've now realized that easy answer that equest twice a year or whatever they
Hmm.
were kind of sold um isn't working. So,
Yeah.
the information that people would have got from tax shops or the information that people would have got from drug company calendars, that format of dealing with parasites isn't working. So they have to come to the likes of yourself and myself. So whether or not I'm seeing more of it because more people are coming to me,
Hmm.
could be an issue too, but I do think there's more of it there as well.
Yeah, and that's I suppose a really frustrating thing because it's definitely not do this and that's for everyone. You know, you'd love it to be just follow this program and that's it done, but it's not. It's individual to the yard, it's individual to the animal, there's so many things.
Yeah.
It's just not a straightforward answer, is it?
It's really interesting, actually. I've been delivering a training program for vets down here, and it's all around herd health, risk assessment, etc. And this whole piece around moving to risk assessment of your animals, just
Hmm.
like you were describing, to allow you to come up with a plan for a specific yard, a specific course, etc. But one of the vets, a good friend of mine, he'd be in his late 50s, early 60s, and he was like, "Nikki, this used to be a lot simpler." I was like, yes, yes, it
We
did.
could only we could only hope.
Yeah, and he was like, "Is there any way you could make this simpler?" And I was like, to be honest, no. And if someone has been making it simpler for you, they obviously don't know what they're talking about. And like that is, I completely agree with you, Ashley. You stand up there, and well, even when these workshops I'm doing, I find by the end of it, everyone's so like, oh God, like as in kind of almost
Yeah.
disillusioned that there's so much to think about, and we can't just go 200 eggs per gram, let's dose that horse, or whatever
Yeah.
kind of black and white advice that has been given previously. Yeah, yeah, I completely
Yeah, it,
agree.
it it really has, and it has changed a lot, I suppose, over the years. Like even in the 10 years that I have been involved in parasitology in Northern Ireland, like the amount of like change in advice, even down to, we're worming and we're not moving fields.
Yes.
And then it was,
Yes.
oh, the worming in the first frost, but sure the first frost could be March now. There's so many changes, and I think
Yes.
that's really difficult, particularly for an owner who just wants an answer, so that it is easy and it is difficult. And there is lots of those companies that are kind of given like guide like year guidance, and they're given like reminders and stuff, so it is helping at least to kind of encourage the testing, but it definitely is independent to your yard, isn't it?
Yeah, and I think, you hit on a few bits there. Like, it can be really hard when advice changes. I don't even know if you remember in the COVID scenario where they told us we didn't need to wear masks, and then we did need to wear masks, because
Yeah.
now there's kind of retrospective research saying probably we didn't need to wear
Hmm.
but someone had to come out and say something. Right.
Hmm.
So, and that's why I suppose I have such respect for parasitologists that went before us, because they had to come out and say something, right?
Hmm.
And even like you mentioned the dose and move, and now we have to move and dose or dose and stay, and that drives people demented because they
Yeah.
really thought they had that down. Or even the rotation of wormers,
Hmm.
and now we're saying, well, actually, it's wormers according to what you're trying to target. You know, we are making it more complicated, but only because we have to.
Yeah.
And actually, as you and me both would agree, if we could just get away from the wormer side of things, parasitology is actually quite simple.
Hmm.
Like parasites come from feces. The parasites that we worry about come from
Hmm.
feces. And if we remove the feces, we remove the parasite. And if people, my mantra at the moment, if people could just start looking at parasites as a pasture issue and stop
Hmm.
looking at it as an in-horse issue, the changes would be
Yeah,
huge,
huge. Yeah.
huge. Because the thing is, whether we like it or not, that's the road we're going down. And
Yeah.
then just to emphasize as well, actually, because I don't want to scare people off, particularly people who have we would consider low risk horses, which I know is something that you guys go into in your education and training, is that, like, parasitism is associated with horses who are exposed to large burdens, have poor infectious immunity, and often then go undetected, okay, and
Hmm.
untreated. So for the majority of horses out there, parasites live very happily within them, and they live very happily with their parasite mates, and they're meant to be there. They're part of the gastrointestinal ecosystem. And, so I don't want people freaking out that they need to try and, well, probably worm the horse, which I don't want them to do.
Yeah.
But it's about looking at your horse through a different lens, isn't it?
It is, that's really interesting. It is that it's the low risk adult horse, which is particularly leisure riders will have as well, and it's just being aware, and they talk about that kind of 80-20 rule,
Mm.
so that's like 1 in 5 horses really, that you are going to have maybe a high shedder, and if you are following along with any of our courses that we're doing in CAFRE, you'll hear that we talk about a case study of a horse in CAFRE, and she's always really interesting because like that, she Blossom is our queen of parasites. So she
Love her name.
is 12-year-old. She's no clinical history of any issues or illnesses. She is always in maybe too good of condition, and she will always keep a moderate to high egg shedding parasite burden, and it never affects her,
No.
and we just monitor her through. And if we every time we worm counted her, if we wormed her every time, my goodness, she would develop resistance herself. The amount, you'd be worming her every 8 to 12 weeks
Yeah,
because she
100%.
would just can't, so we just monitor and just making sure that we're aware she's not going to go and live with our foals and our young stock. She's not
Exactly.
going to live with our elder pony. She's just in with other healthy adult horses. So it is manageable, and
100%.
and as you said, they're all living in this symbiotic relationship together, you
Yeah,
know.
and this is a huge part of what people miss, as parasites have been sold as, bad things we need to get rid of. But just like gut flora, well, actually,
Hmm.
they are the gut flora, right? Like nematodes, gastrointestinal nematodes have been living with horses for millennia, and we just came and we made horses eat in their toilets, and suddenly we completely overloaded them with the infectious dose on the ground because we left feces and larvae and everything on the ground. And that was all well and good when we had these magical macrocyclic lactones. So that's your Equest, your
Hmm.
Equimaxes, all those that just clear them all out, but they don't clear
Hmm.
them all out anymore. So,
No,
you know,
unfortunately.
so yeah, if we go back to how they were meant to live, firstly, they were meant to live in mixed groups. Right,
Hmm.
so you're meant to have your foals and your yearlings with the mares and whatnot, and so you didn't have all of these young animals kept together who have low immunity and high burdens,
Hmm.
which is step number one. And the second thing was that they were allowed to defecate somewhere, and their dung would be somewhere, and they'd move on to
Hmm.
cleaner pasture,
That's
and
it, yeah.
so continuously having a certain level, like there's a couple of really good researchers who follow wild horses, and loads of them would have high egg counts, but as you say, very few of them
Mm-hmm.
have
Clinical
endoparasite
symptoms.
disease. Yeah.
Yeah, yeah. Yeah, no, it's really interesting. And I suppose one of the biggest questions I was going to ask you, Nikki, is very simply, why is parasite control important then? We've talked about all of the
Yeah.
kind of issues that can happen, but when we talked about our adult horses there, but why is it then important that we are aware of it, when we're monitoring our parasite level?
Yeah, well, it all comes down to the risk element, So like when I was growing up, we had thoroughbreds and hunters and whatnot. Like for instance, we would have had two hunters out in a 10-acre paddock. Like realistically, those horses could probably get away without being wormed at all, or maybe once a year, right? Okay,
Hmm.
because their risk is low. So when it comes to parasite control in that regard, if the pasture was cleaned, relatively clean, or at least the stocking density, so that's how much stock, so how many animals are on a pasture, then the infectious burden would have been very low, right? But when parasite control really comes to the fore is when you're working with immune compromised animals. So that's very much our foals, yearlings, 2-year-olds, 3-year-olds, even up nearly as far as 5, but certainly 0 to 3. And then on the other side of that pendulum, which is, the 15, 16, 17, who often get forgotten, right?
Yeah.
Because they've been great soldiers, never had a problem, and then suddenly they get something like Cushing's that brings down their immune system, or just age in general, and they can suffer as well. But very much that younger cohort. If we don't control the parasites on the pasture with those animals, and we allowed infectious doses to get very high, we will see disease. And the problem is that, yes, worming is part of that, and particularly from that 0 to 1 to 2 stage, we do need a good approach with efficacious wormers, which we're now struggling with. Efficacious being that they actually work. But if we have wormers that work, if we allow those animals to be on pasture that has fecal contamination with high levels of eggs that turn to larvae in those fecal paths, it doesn't matter what wormers we give. Like the analogy I give is, if you could imagine that the horse is the bucket and you have a tap turned on, if you take out one jug, they're still going to overflow, right? So the wormer is that one jug. It only is at a point in time. If you allow the flow of infectious larvae to keep going into that horse, then that's going to be the problem. And I think one of the things we talk about, actually, the fecal egg count trick that we like to do with people, that like take simply 200 eggs per gram, that's 200,000 eggs per kilo, right? And then we multiply that up to let's say a yearling, let's say 15 to 20 kilos of feces a day. You're talking about nearly 4 million eggs on the ground in a day if it was linear, which is not necessarily, could be higher and lower than that. But that's in one horse in one day. Put 10 yearlings out, or 3 or 4 on a small paddock, and day after day, year after year. Like, I don't, how do we not expect our animals to then develop parasite disease,
Yeah. Yeah, when you put it like that, isn't that it's crazy, the potential infection rate that they have. And as you said, you then put them all out together and potentially on the same nursery paddock that you did the year before, which is very common.
Yes.
And all of a sudden it's like, oh goodness, how did we end up with this big infection? But it's there. It's just because we can't see it. It's difficult then to comprehend the exposure risk, isn't it?
And people, like, as in, larvae are smaller than an eyelash, right? Okay. And like we described there, millions can grow and can formulate on the ground. And then when it comes to the ones that I would have most interest in, which would be the small red worm, or cyatostome, we call them, like, for the people who have done the work and counted the amount of larvae that can develop in the gut of these horses, in the walls of the gut of these horses, they can get up to 3-4 million,
Yeah.
And like, yes, they're microscopic, but it doesn't matter if there's 4 million of them in there. And that can be in clinically normal horses. So you can only imagine the ones that present with clinical disease, the level of infection that they can get to. But it's not surprising if we make them graze in pastures that are highly contaminated. Like, what else do we expect? And then we give a wormer and we think that's going to fix it,
Yeah.
And it might have mitigated it to a point, but especially with intensively farmed young animals, it's not fixing it now.
Yeah, yeah. And you'd spoke about there a little bit there about that small redworm, encysted small redworm. I know it's something that everyone's kind of aware of at the moment with the new blood test, and it's always a really bit of a concern. You did a bit of research on that back in 2021. What kind of explain a wee bit about that for us, Nikki, to kind of give, I suppose, a wee bit of a as basic as possible approach to what it actually entitles and mean, because I think there's a bit of a mixed kind of knowledge on what that encysted small redworm does and how it affects. People think it's just 1 year-on-year wormer and it's done and over with,
Yeah, they do. Yeah, definitely. We were sold a pup with that one, weren't we? Yeah. So look, the thing about it is that every horse that has ever been looked at in regards to fecal egg counts or in abattoir studies was infected with small redworm, right? So it is like every horse who's seen a blade of grass in his life will have some form of small redworm infection. So, it is meant to be there, right? It is part of the system. That's fine. So you have that. And majority of horses can actually tolerate a really high burden. Like I said, we have clinically normal horses who, from abattoir studies, we can tell had up to 2 million cytostoma in our small red worms in the walls of their guts. Okay, so they can tolerate very high burdens, right? Now, it would interfere with them, but not to the point of them certainly presenting with high level clinical disease or dying. So when does it become a problem? There's two ways. So one is if we have massive buildup like described in the walls and we have adults in the gut, it can interfere with how that gut functions. It can present maybe as colic, or it could present as chronic weight loss. So these animals that just are ill thrifty, that wormy horse you described at the start, right? Ill thrifty, coat doesn't look good, etc. But I suppose the area of interest for me, and the one that should be of most concern to all of us, is then the acute or the sudden presentation of severe disease that we see in these animals. So how that happens is, if you could imagine that these worms like to live in the walls when they're in their younger stages, so in their immature stages, we call it encysted. So they basically create this little lovely cocoon in the walls. And if they are all there and they come out intermittently, right? So they come out when, section A can come and section B, a bit like as if you're, getting people off a plane, okay? And if we get, if everyone comes off in a nice orderly fashion, we're fine. The problem is that, and oftenly the trigger is anthelmintic or worming the horse. If we get rid of the adults very quickly, and this is very important, and we have a massive burden in the walls, right? So not your average horse, but you're talking about a horse that's very heavily parasitized. The adults, we think, we're telling the larvae to hold on there and only come out intermittently because we don't have a lot of room for everyone. But once you get rid of the adults, then it triggers all of these little larvae or immature stages in their cocoons to all come out at the same time, or certainly a few layers of them, okay? And like, if I could even, like, I should, show, I can send you some of the pictures. They literally rip the walls down, okay? They destroy them. Like, and the problem is then that horse cannot function in regards to its gut. So when it doesn't function in regards to its gut, it can no longer metabolize or get any nutrients from its food, okay? And hindgut fermenting is number one in horses, right? 60-70% of their energy, as you well know, comes from there. They lose a lot of the proteins from their blood, leaks out. So people would have heard of leaky gut syndrome. Well, this is like torrential leaking. Like, this is a deluge, okay? So protein just gets dumped out. Massive inflammation. The horses that we see have reflections in their blood of inflammation that is sky high. You wouldn't see it in any other disease. And they also get a disruption of the gut flora, the actual microbiota, so the bacterial level of gut flora, which contributes to propagating this problem. And so these horses go into this like really vicious cycle of inflammation, larvae coming out of the walls, what we call a dysbiosis, and almost like an unregulated immune response, because the parasites, we're probably keeping that at bay. That's one of the cool things that they do. And so these horses fall apart in front of your eyes. So they go through what we call a melt. So if any of your listeners have ever had a horse, they wormed and then suddenly it looked like they almost lost body condition, not just weight, like body condition. Post worming, often 2 to 4 weeks post worming, that's probably what was going on. And if they're still alive today, well done you. But it does have a high fatality rate in referral centres. But if you can manage it on a farm, they can survive. And I say that because if they've gone to the point where they have to be referred, you're probably going to lose them. And so what we try and control are the elements that we're presented with. So the larval emerging, so we need to try and treat those with anthelmintics, so with wormers. We try and deal with the inflammation, so we treat them with corticosteroids, which can be immune suppressive, which we kind of want as well, because that we have that overzealous immune reaction, and then just supportive therapy and hope, really. So yeah, that's the kind of work we would have done, is trying to find out why. Because what happens a lot of the time, if you have an outbreak, which just means that the level on the pasture must be massive, and there's only so much horses can tolerate. It often happens in like a spectrum of clinical signs. So you have the top ones, which will either be hospitalized or dead. Then you'll have a next cohort who will be quite severe, and then you'll have a next cohort who won't really suffer as badly, but will still probably lose a bit of weight, etc. And we're not sure. We think it could be related to the gut flora. We think it could be related to the immune system. We think it could be related to the parasite burden. We're not sure, but yeah, they do. Different horses suffer in different ways for this disease. But like that, for your average horse, this isn't a problem. You have to have those factors,
Yeah.
and it often is the case that horses aren't looking great. So someone worms all 3 of them or worms all 6 of them, and suddenly they all start to present with clinical signs. So it's just been a little bit wary of that.
Yeah, you'd hear, where you've bought a new horse and you've brought it in and someone's just put a wormer into it, and then all
Yes.
of a sudden it's got really sick, or like you said, that melt away where they've just dropped everything and then all of a sudden they've, started to put condition back on again after a couple of weeks and you're
Yes.
thinking, what's happened there? Or colic, and it's
Yes.
just like, oh, it's a new place, but it could be because of that wormer that was given.
Yeah.
Um, and with that then I suppose that's it. Obviously, you'd said it was a kind of a massive high burden. We can end up with all those clinical symptoms. Is there any symptoms that can be presented if they do have an insisted level that
Mm.
maybe isn't at that extreme?
Well, that chronic horse that we spoke of, that wormy horse, is often
Mm,
indicative that there is some level of parasite. Because people are like, oh, he looks wormy, and it sometimes can be a bit dismissive. A bit like when
mm,
people say, oh, he's a bit lammy, and I'm like, when he's
yes.
laminitic, and I'm like, well, it's very severe and sore disease. But yeah, same idea. Oh, he's just a bit wormy. We'll throw a wormer into him.
Yeah.
Like I would always be worried about that, particularly if they're young.
Yes.
Because yes, they might respond perfectly, and that can be fine, right?
Yeah.
But even if you could just get your vet just to take a blood, and I don't mean for the small red worm test, I mean
Yes.
for hematology biochemistry, so looking at the immune cells and looking also at proteins and things like that, you can get a much better indication if there's something ongoing,
Yeah.
and then your vet can dose that animal, but also give them steroids to stop that massive inflammatory reaction, if
Yeah.
they feel that the risk is
That
there
there's
that it could occur.
potential.
Yeah.
Yeah. No, it's really interesting because I think it was always we're worming that horse at winter time and then this potential mass emerge could come at spring. And I
Yes.
remember years ago and and it was really what's the trigger for it? Oh, it could be just that it's warmer weather. Do you know, there was very little understanding of what it was. But whenever I'm talking and explaining anything about it, I always like to say, oh, they all have like a WhatsApp group and they've all messaged each other, right, lads, it's time to come out now, rather
Yeah,
than them
that's
coming out in
exactly.
bits.
Yeah, that's
Um,
exactly it.
but yeah, it can be quite devastating. And interestingly, like especially over the last probably 5 years, I've come across a lot of horses that have had to be referred or
Yeah,
and it's scary, a lot of
it
that
is.
that it's happening.
Yeah, so a paper is just about to come out, that Sarah O'Dwyer would have written with me and my PhD student Orla Byrne, and yeah, it's about an outbreak in thoroughbreds, and one of those thoroughbreds was sold for like over 100,000 in December just gone.
Mm,
So like you're saying, like it's starting to come, because even in that year we had 2 other outbreaks which were both in thoroughbreds, and there was 9 in one, 6 in another, and 4 in another, right?
mm,
So, we are certainly seeing it. And now that I'm doing these workshops with vets, they would say to me, yeah, no, I've seen that. Yeah, I
yeah.
just didn't recognize it as that. And do you know what the big red herring is, Ashley, is that people do fecal egg counts
Mhm.
and there's 0, right?
Yeah.
But, people just need to remember that like a fecal egg count means that there has to be an adult female there to produce the eggs.
Yep.
And one of the biggest, well, the trigger for these guys is the removal of adults, like you say, either by time of year, because
Yep.
generally these adults only have kind of a year in them, or worming. So if your fecal egg count is 0, to be honest, and you have a horse presenting with this, it would even be more indicative for me that that's
Yep.
what's going on.
That's what it is.
Now we do in UCD now. Sorry, I'm not in UCD anymore, am I? They do. Orla does. She looks at feces for larvae in the feces, which can be
Mm,
really helpful for diagnosis. It's not always there, but if it is there, you're bang on.
yeah.
So if you were worried, you can definitely send feces down to UCD, and they'll do that for free.
Oh, that's really good
So
to know.
yeah, so it's really handy in those cases where you're humming and hawing and you're just not sure, because if you sell down, like if you could collect like samples 3 times in a day or even over 3 days, or what is as many samples as you could, and send them
Hmm.
to us if we find larvae at all, because larvae are not meant to be there, right?
Yeah.
So if you, and that's the other thing, these aren't actual red worms, they're white. So
Yeah.
if you are seeing red worms, that's one of the larval stages. So please be very careful of that horse, because that means there's larvae in the poo and it shouldn't be there.
Yeah. No, that's really interesting. And I have another question for you just to keep us going, I suppose, on because
Yeah.
we could go down rabbit holes. I know we could.
We would, yeah, yeah.
So what would be your perceived implications and barriers of this sustainable parasite control that we're kind of uh, advising at the moment?
Yeah, I think sometimes now you're very good at this, Ashley, but I think there are some advisors or guideline creators, or academics like myself and yourself or whatever, that forget how hard it is to do some of the things that we advise,
Mm.
you know?
Hmm.
Um, and it doesn't matter if we give the best advice out there if it can't be implemented on a farm, right?
Yep.
Because then it's useless to everyone. And I suppose I do a lot of herd visits, so vets get in touch with me if they're worried about a particular establishment, and I go out and we walk the farm, and we sit down for like an hour discussing all the things that would be related to trying to risk assess a parasite issue on a farm. And then the most important piece actually is we actually, and I know you know a lot of this from your motivational interview, we actually sit down and go, okay, well, what can you do? You
Mm.
know what I mean? I'm not going to get you to go out and poo pick 4 10 acre paddocks, because by the time you've done that once, you know you'll have broken your back and that'll be the end of it. You know what I
Yeah.
mean? Um, and so what can we do? And you know, like some of the work we've done around the Epic 5, which of course we still haven't released, is that, you know, we did a lot of focus groups with all the different, we would call stakeholders, so people
Hmm.
involved in the equine industry, from leisure to thoroughbred to sport horse to riding schools to charities. And you know, we came up with what we felt was going to be helpful and that people could try. And even if they did one, that would be helpful.
Hmm.
And I suppose that's the way you're trying to get around barriers, because, like that, the barriers that come up all the time are time, resources, money,
Hmm.
right? And we're all in that. We're all time poor. Many of us are now money poor, and resources, like people cannot get people to work on horse farms anymore. And if they're lucky enough to have the money to get someone in, you know,
Hmm.
so what can they do within that time? And so what we found was, number one, when we did a lot of work on this, number one, when we asked people to talk about parasite control, the first thing they talked about was wormers. And so if we can get people, the first thing they talk about is if they could tell me, well, actually, we don't put our yearlings on the same pasture year after year.
Yeah.
Actually, when a foal is finished in a nursery paddock, we take out the feces before the next one goes in. I'm not saying pick up poo every single day, but just something, you know.
Yes.
Actually, what we do is we put our older stock ahead of our younger stock,
Yeah.
instead of putting the 2 year olds ahead of the yearlings, whatever that might be. So try to get people to look away from those calendars and start looking at their pasture and going,
Yeah.
okay, well, like if I wanted to decrease the feces on this, what could I do, you know?
Hmm.
So that would be barrier and solution number one, even just looking at things differently, right?
Mm.
Because it was so interesting. Like we asked 20 different people and no one talked about anything but wormers. Then
Yeah.
we pushed them to talk about other stuff. um, the other thing was that they didn't see the vet as part of the prevention program. Okay,
Mm.
they only saw vets as someone they called in for clinical disease, and they're often afraid of the vet coming in and
Yeah.
asking whether the horse was wormed. So they'd have the horse well wormed, as they love. I love that, well
Yes.
wormed,
Well wormed.
well
Yeah.
wormed. Or as they used to say to my students, because I would have brought students on the road, the student would come back to me, they're like, yeah, their vaccination and worming is up to date. And I'm
Yeah.
like, what does that
Does
even
that
mean?
mean?
See
Yeah.
that up to date piece, like that
Yeah.
calendar piece again. So yeah, so that was the other big thing, that like vets were never really seen as people who could advise. And I think we're changing that now. I really do. And I
Yeah.
think the likes of yourself and myself are helping in that. Um and then the other big piece is that people really didn't get this resistance, right? So a bit like antimicrobial resistance or antibiotic resistance, people know the phrase because they've heard it so many times. Antibiotic resistance, they've heard it, right? But when I asked them what it would look like on their farm or how they'd find it on their farm, they're like, well, how, I don't know. I don't think you could. But if you went back through what they discussed in the previous, usually hour, they had said that they'd given a wormer to a wormy horse and they didn't respond. And they
Mm.
just gave him another one,
Mm.
but didn't recognize that that was an indication that that wormer isn't working. And people are like, oh, it's grand, I gave another one. But if you start to select for resistance, you're
Yeah.
selecting the best of the best when it comes to worms, and they will find resistance to every other
Yeah.
thing too, you know. So I think they were the three things that we were fighting, and the last thing that we fought a lot was tradition. So because we had macrocyclic lactones or ivermectins, moxidectin coming in the 1960s, 70s, we have now an approach that has been instilled in people over time that they've trusted in. And I find it's not until they face disease that they really want to change that.
Yeah, yeah. Yeah, that's really interesting. It's that whole approach, isn't it? And
Mm.
as you said, and I think it was a really good point and a good point to end on, is that it is a pasture problem. It is looking at pasture management. It's not the horse itself,
Yes.
and we've definitely in CAFRE have done quite a lot of work recently, especially this year, on that environmental impact, not only
Yes,
the impact
absolutely,
of
Ashley.
those
Yeah.
chemicals going into our horses, but into our environment, and then the
Yes.
potential risks of, all of that ecosystem in, that can come off that. But maybe that's another podcast
I was going to say, yeah,
episode.
well, let's not start that one.
Yeah, well, look, thank you very much, Nikki. That was really, really good. And we'll finish up
It's been an
there.
absolute
And
pleasure.
yeah, thank you.
All right, take care.